But let me go to Onyedikachi in Port Harcourt as we are talking solutions now. And I'm asking, do you see a role for families and communities in delivering safer maternal health care, safer motherhood in Nigerian communities particularly?
Thank you. Before I respond to that, let me quickly touch on digital health technology. You mentioned telemedicine, and there are proven solutions that are currently being implemented. I'll give two examples. There's the Complete Health app. This is a virtual self-care support app that provides women with information on prompts when to visit the health facility, monitors their weight, blood pressure, gives them real-time feedback on when they need to access in-person care for those times they are outside the health facility. And this is something that uses low internet connectivity, almost similar to the USSD device that we use on our mobile gadgets. There is also the Navi Health platform. This is another digital health platform that now collects women's voices. When I say women's voices, women's experience. We've talked a lot about women's experience when they visit the healthcare, the need for respectful care from healthcare providers, because these are the things that would shape whether the woman is going to come back to that health facility, or the attitude of the provider will actually determine that. In designing programs, in making decisions, in signing policies for women's health, it's important to put into consideration women's voices, women's experience during childbirth, during delivery, postpartum period, because women's experience and using this feedback is critical in quality improvement. We've talked about, different pillars of quality this morning, from the attitude of the health worker to the presence of critical infrastructure that will provide quality care. So women's voices is another part of it. So Navi Health does this by giving the women the platform to provide feedback on the kind of care that they receive. And this is collated into improving quality in respective health facilities, in respective health workers, finding the gaps. Does this health worker require training, and all of that. So these things are already proven to work. They already exist. However, they need to be scaled so that more women in underserved regions can have access and begin to use this digital technology to enhance their healthcare service provision, because it's a whole opportunity, a whole world opportunity existing there for digital health technology. Now, talking about the role of families and communities, it's very critical. Cannot isolate the role of families and communities in improving maternal health care. Every Nigerian, as a matter of fact, should be informed, because maternal health is not just women's business. Neither is it the business only of those in the media or those in the health sector. It is everybody's business. We all have mothers, we all have sisters, we all people have wives who we are talking about, because when we talk about maternal mortality, it just sounds like a very far number. If Nigerians, to bring it home and tell us how critical these figures are, once you close your eye to think of women dying in Nigeria, every Nigerian knows at least one woman who has died from giving birth in Nigeria. So the numbers are, the figures are staggering. So people, families, communities should be aware of the state of maternal health, the state of maternal mortality in Nigeria, and provide that concerted effort. There's something we do in Nigeria Health Watch where we pull together stakeholders and individuals from across various sectors in Nigeria, from health, education, the arts, the different sectors beyond the health sector, to talk about maternal health through an art gala. We just concluded the last one during the International Women's Month on the last Friday of March, where we put together various stakeholders to talk about maternal health, now using art, because some people would never know about maternal health except you are innovative in providing these awareness. We call the event the Celebrating Womanhood Art Gala. And we used various forms of art to buttress the maternal health issues in Nigeria and prefer recommendations that can be used by families, communities, individuals, policymakers, very, very critical to improve maternal health in Nigeria. We used exhibited artwork.
Many thanks, Onyedikachi. Great